Because of the flooding and the shootings that occurred here in Baton Rouge, it's brought a lot more pressure on the public as well as on providers. There's been a lot of stressors in this community.
It is very, very sad the way many people were impacted and are still impacted. You're probably not taking the best care of your health as a first priority when you're faced with how do I rebuild my house and where am I going to sleep tonight?
Those are all challenges that have directly affected healthy lifestyles. Really, people want to get healthy. They just don't have a pathway to do it.
All the aspects that make up health in a healthy community that sometimes are not thought of as health. They're not doctor's office visits, they're not clinics. It's transportation, it's education, it's job opportunities, it's public safety, and that those factors that contribute to a healthy community are important to everybody. And so when we're working successfully on those items that are the key components of making healthy individuals and healthy communities, we're helping everybody.
What we saw in our community before the formation of the health district was a number of health systems and hospitals working individually, but we realized that the sum of our parts was better when we worked together. And so that's what we also see through this Humana initiative, is that everyone coming to the table, being committed to seeing similar outcomes, working collaboratively towards that, we can accomplish more.
So we hosted a town hall, and the point was to get a true understanding of what was needed in the community. And what we're doing is we're taking the 3 or 4 topics that the community want to focus on more, and some of it has yielded new pilots and new ventures, but a lot of them are just coordination of things that are already there and adding our piece to it.
There is a recognition that planning and public health need to come back together, and so this has been a great opportunity for CPEX as a planning organization to make connections with some of these health-focused organizations and start to think more about how we can partner.
No one organization can make this lift the right way by themselves. That is the sole barrier. Collectively, the lift gets much easier and much faster.
We're all looking for the same thing, whether you're a provider or you're an insurer. We really want our end goal to be that people are healthier in the long run and that what we've done has made a difference.
The work that I see being done here is people from Baton Rouge who live, work, and play in Baton Rouge leading the charge to make Baton Rouge healthier with the support of Humana. I think Baton Rouge is headed in the right direction. After a lot of the things that have happened here, we are all willing to work together. And so Baton Rouge will be much stronger than you've ever seen it before.